Good afternoon. First of all, I feel honored to be here presenting our one-year experience with this prosthetic valve for PTS. This is my disclosure. According to Medicare database, there are more than 1.2 million people in the United States with open ulcers due to CVI. The strategies offered for PTS patients vary from open surgical repair to compressive therapy with poor results in general, with a few phenomenal Italian exceptions. The vena valve is made from non-coronary porcine leaflet stitched to a 10 mm stainless steel frame. Our endpoints were to evaluate safety, which is an important endpoint in any first-in-man study, reflex by duplex ultrasound, as well as clinical assessment by the clinician. Also, pain scoring and quality of life outcomes were evaluated by the patient during this study. We have learned many things regarding the implantation technique since the first case performed more than a year ago. We include in our trial axial deep reflux C5 and C6 patients. Superficial reflux was controlled or ablated prior to the study or non-existent as an inclusion criteria. In all our cases, we had secondary vein incompetence due to postphobitic syndrome. Our patients were able to walk by themselves and PAD was ruled out by ABI. Obstructive lesions were excluded in this study, as in Colombia venous stenting is rarely performed. This is an ongoing trial. We just finished the 10th case, and 3 weeks ago we finished the follow-up of the 11th case. Here we present 10 cases that achieved the complete follow-up of 1 year. Our average follow-up of this cohort is more than 200 days. Please note the decrease in reflux 45%, decrease in VCSS 57%, and decrease in VAS by 62%. As you can see, all patients have demonstrated marked improvement in their reflux, most of the patients reaching normalcy. We have seen significant changes in patients with improvement in reflux as low as 30%. Significant clinical improvement were also observed in patients, many of them going from moderately severe to mild disease by clinical assessment. On average, VCSS scores have improved 9 points per patient. Again, pain perceived by patients has been greatly reduced by all cases. This slide shows the average percentage improvement at each endpoint at 30 days, 60 days, 90 days, 180 days, and 1 year. Significant percentage improvement in reflux VCSS score and VAS score was noted. 3 C6 patients healed within 90 days of implant. No new ulcers occurred in any of the patients in this study. Average ulcer-free days was 130 days for C6 patients who healed. VANS scores of the cohort of patients that reached 6 months showed significant statistical improvement over pre-op level, both at the SIM score and QOL score. These are very interesting results. We had 1 seroma that was successfully aspirated, 1 nightmare of over anticoagulation with Coumadin therapy, 2 minor wound infections treated with antibiotics in C6 patients, and 1 valve thrombosis at the 5th month due to non-therapeutic ranges of anticoagulation and non-compliance. An upper mid-thigh was performed, exposure of the femoral vein was achieved, and a longitudinal venotomy in order to accommodate the valve was done. A bovine pericardium patch was used, and 6 stitches were placed to secure the valve into the vein wall. Even though ulcer healing was not a main point of this study, dramatic healing was noted after the procedure. This is the patient who had 2 ulcers treated for more than 2 years, and after placement of the vena valve, ulcers were healed at 60 days. In conclusion, we had no serious events at this point of our follow-up. An overall improvement in reflux by 51%, clinical improvement by 61%, with an average of 8.4 points, and 65% pain improvement. We evolved our implantation techniques with average time of implant from 2.5 hours to real 40 minutes time right now. Our results are from the feasibility study. but we will evolve to a second phase pivotal trial that will begin 3 weeks from now, with more recruiting centers and an increase in the number of cases to assess the performance of this prosthetic valve as an option for patients with C4B to C6 patient diseases. We are still looking very closely to this cohort of patients to see the behavior of this prosthetic valve in the near future. You will have in your emails in the near future, in the next weeks, the acceptance of this paper and the publication that will expand what we have been exposing to you today. Em meu nome e meus colegas deste estúdio, ótimas graças pela sua atenção e paciência com meu sotaque. Obrigado.